With the growing prevalence of sleep-disordered breathing and other chronic respiratory conditions like COPD, the need for consistent, high-quality, non-invasive ventilation systems is greater than ever. For over 30 years, non-invasive ventilation has become a standard of care. And since the launch of the BiPAP Vision, Philips has been providing effective and affordable NIV solutions compared to intubation and invasive airway management techniques. With the V30 Auto Airway Management System, affordable care is enhanced with low-acuity non-invasive ventilation that uses Philips' proven algorithms that efficiently treat patients within the hospital setting and beyond. With features like auto-titration, a simple interface, hospital-grade alarms, and a convenient roll stand, the V30 Auto is designed to improve operational efficiency while addressing the needs of your low-acuity, non-invasive ventilation patients. This short instruction video is intended to help you understand the V30 Auto's benefits, various features, and the steps to take to assemble, use, and maintain your V30 Auto device. The V30 Auto is a familiar device for those using the Philips family of ventilators in the hospital or home. Using the same proven auto-track algorithm and clinical modes, the V30 allows for clinical and operational consistency. This is especially beneficial to those in general care areas. In fact, research shows that 22% of adults presenting for inpatient surgery screened as high risk for obstructive sleep apnea, or OSA, and these patients present workflow and clinical challenges on low-acuity general care floors where caregivers may be unfamiliar with respiratory devices. The Philips V30 Auto was designed for these situations. It's a non-invasive system that provides all the modes currently available in Philips home care units, but built with a hospital's operational needs in mind. With hospital-grade alarms, long-lasting battery, and a roll stand for mobility, the V30 helps take the guesswork out of titration by using Philips' proprietary technology to automatically titrate pressure to each patient's needs. It also includes a number of clinical features like various flex modes and auto-titration settings designed to ease patient setup and adherence to therapy. The V30 Auto's four most common operating modes are Auto CPAP, Auto Bilevel, A-VAPS AE, and ST. Auto CPAP and Auto Bilevel are designed for sleep-disordered breathing, like diagnosed or suspected obstructive sleep apnea and obesity hypoventilation syndrome. Philips' clinically proven A-VAPS AE algorithm optimizes pressure support for chronic respiratory failure, such as patients with COPD. And ST with A-VAPS is a popular hospital mode, commonly used on COPD, OHS, and neuromuscular disorder patients. The V30 is also equipped with Auto Servo Ventilation, or Auto SV, which is intended for adult patients suffering from respiratory insufficiency and OSA caused by central and/or mixed apneas and periodic breathing. Note that Auto SV is only recommended for patients titrated with a sleep study. Before we go deeper into setup and operation, let's take a quick tour around the exterior of the device. Beginning with the top of the device, let's first look at the screen. The graphic user interface is familiar, simple, and intuitive. The connection to your single limb circuit is to the right of the device. Install a bacteria filter here to filter air to and from the device. On the back, you will find the power cord connection, the device inlet filters, nurse call connection, and the SD card for data management and collection. To the left of the graphic user interface is the optional battery compartment. When opening the compartment, you'll notice that the battery is interchangeable with the Trilogy 202 and Cough Assist T70 batteries. However, when used with the V30, the life of the battery is up to 7 hours, depending on current settings. When unboxing the V30, you'll find a few items needed to get the device patient-ready, including a reusable gray foam particulate filter, as well as a white ultrafine filter that is disposable. If these filters are not already installed when you receive your device, you will need to insert the white ultrafine filter here, and then the gray filter like this. If you're using AC power, plug the socket end of the power cord into the power supply and the pronged end of the power cord into an electrical outlet. Now you will need to connect the battery module if equipped. To connect the battery compartment to the V30 Auto, remove the side cover, line it up with the device, and press the two together until you hear a snap. Once it's in place, you can insert the detachable battery into the compartment and close the lid. After that, plug in the supply cord connector into the power inlet on the back of the device. In order for the V30 Auto to be mobile, you will need to assemble the roll stand. The assembly is fairly simple. Just follow the instructions provided and place the V30 Auto onto the roll stand. Oxygen may be added anywhere in the patient's circuit or directly to the patient interface as long as a Phillips pressure valve is placed in line between the device and the oxygen source. Once in place, turn the device on and dial in the appropriate oxygen flow. The inspired oxygen concentration may fluctuate depending on the set pressures, patient's flow, and circuit leaks. Substantial leaks may reduce the inspired oxygen concentration to less than the expected delivery, so appropriate patient monitoring should be used as indicated, such as a pulse oximeter with alarm capabilities. Please note, you must first turn off the oxygen flow before turning off the V30 Auto. This will prevent oxygen accumulation in the device. If oxygen is left on and accumulates in the device enclosure, a fire hazard could be created. Next, to power on the device, select the power button from the front. You will see the main standby screen, which includes the time and date, current mode, and soft keys used to enter the menu and begin therapy. For ease of operation, there are only two menu layers to navigate. To set up the V30, select Menu from the standby screen using the up arrow and then choose the topic. You can now adjust any and all relevant settings and options. The Settings and Alarms screen allows you to adjust modes and other clinical functions by using soft keys to navigate menus, select parameters to modify, and to confirm settings. Before initiating therapy, you will need to ensure that each mode and parameter is appropriate for your patient. For more detailed instructions, see the Initiating Therapy section of this video. The Options screen allows you to customize non-clinical device behaviors and appearance, such as language, screen layout, and units displayed. Many of the choices here are simply set and forget. The V30 Auto has a full complement of patient and system alarms, as well as information messages. In the case of each of these high-priority alarms, the V30 will continue to operate, and the audible sound will terminate once the alarm is resolved. When an alarm is active, the clinician can silence the alarm for 60 seconds by pressing the alarm indicator and audio pause button. If the cause of the alarm is not corrected during that time, it will continue to sound until corrected, or until there is an additional press of the alarm indicator and audio pause button to add 60 seconds. You should note that there is also a pre-silence alarm feature. If an alarm occurs during that time, the audible indicator will not sound until the end of the silence period. Refer to the user manual for additional information regarding the system alarms and information messages for the V30 Auto. The V30 has several alarm options located in the Settings and Alarms menu. Using the down arrow to navigate, you first come to the Circuit Disconnect alarm. When a large continuous air leak is detected in the circuit, such as the patient's mask being removed during therapy, this high-priority audible alarm will sound. The audible alarm will terminate once the leak is corrected. Next is the apnea alarm. This high-priority alarm occurs when the patient has not triggered a breath within the time specified in the alarm setting. The alarm will automatically terminate when 2 consecutive patient breaths are detected that meet the apnea alarm time setting. The low tidal volume alarm is a high priority alarm that occurs when either the AVAPS or AVAPS AE mode is enabled and the target tidal volume cannot be reached. Once the target tidal volume is reached, the audible alarm will terminate. The low-minute ventilation alarm activates when the calculated minute ventilation is less than or equal to the setting. This high-priority alarm will continue until the estimated minute ventilation is greater than the low-minute ventilation alarm setting. Finally, the high respiratory rate alarm activates when the measured respiratory rate reaches or exceeds the selected setting. Now that your V30 Auto is ready and you're familiar with its basic operation, let's discuss setting it up for patient use. When setting up a patient on the V30, it's important to select the right equipment. Be sure to consider the following 3 components: mask selection, the NIV circuit, and humidification. Choosing the right equipment is critical to providing optimal NIV, so keep in mind that the V30 Auto uses the same Philips masks and circuits as your V60 and Trilogy 202 to help ensure you can find the right fit for your patient. First, turn the device on by pressing the power button. Once the unit is on, note the date and time in the center, the last mode of ventilation in the top left corner, and the menu and therapy soft keys at the bottom of the screen. Now it's time to choose a patient interface. Consider a mask size with proper fit that can be easily repositioned. Helpful sizing gauges are included with many types of masks. Leak is an important factor to consider when administering therapy because leak will vary by patient. Be sure to select the correct combination of mask and elbow to compensate and achieve desired clinical efficacy. The Philips AF541 mask offloads pressure points on the skin to better support your mask rotation strategies. Pressure injuries are classified as a preventable hospital-acquired condition, or HAC, and are no longer reimbursed by today's insurance guidelines. But mask rotation is a proven way to decrease skin breakdown by varying the pressure points on the skin. Philips offers a wide range of hospital-grade patient interfaces, like the AF541, which offloads pressure points on the skin. Philips also helps support your mask selection and rotation strategies with resources like the Saving Face program to help you choose the right solution for your patients. It's also important to select the proper circuit for your patient. The V30 Auto is designed to work with either heated wire or heated passover humidification, or without humidification. Please note that some home care masks have built-in leak ports, while most hospital-grade interfaces utilize a leak port in the circuit. Ensure you have the proper combination of mask and circuit to manage leak and achieve clinical efficacy. When the upper airway is bypassed during mechanical ventilation, humidification can help prevent hypothermia, disruption of the airway epithelium, bronchospasm, atelectasis, and airway obstruction. In severe cases, inspissation of secretions may cause occlusion of the endotracheal tube. While there's no clear consensus on whether additional heat and humidity are always necessary when the upper airway is not bypassed, such as in non-invasive mechanical ventilation, active humidification is highly suggested to improve comfort. And remember, the bacteria filter is always required, with or without humidification. To use humidification, connect the bacteria filter to the device air outlet and then connect it to the humidifier. From the humidifier, connect the circuit to the patient mask selected. If not using a humidifier, place the bacteria filter between the device air outlet and patient circuit. When selecting therapy, the V30 Auto is able to provide clinicians a total of 9 modes to meet a variety of patient needs. This includes CPAP, bi-level modes, spontaneous, spontaneous and timed, and pressure control, as well as AVAPS AE and auto CPAP, auto bi-level, auto servo ventilation, or auto SV. With auto-titration, the device automatically adjusts EPAP, CPAP, and/or IPAP to meet the therapeutic target. As the user, you will define the minimum and maximum pressures for each patient. To begin therapy, first navigate to the Settings and Alarms menu using the arrow keys and by pressing the right soft key for Select. Using the up and down arrows and soft keys, modify each parameter to suit your patient. Press OK to confirm the change. Once all settings are updated, use the left soft key to select Finish, then Exit and return to the main screen. Begin therapy by selecting Therapy from the main screen using the right soft key. To pause therapy, press the power button and use the right soft key to select Standby. This will cause airflow to cease. To restart, select Therapy by pressing the right soft key from the main standby screen. The V30 Auto was designed for easy cleaning with multi-patient use in mind. When using the V30 on multiple patients, the device exterior should be disinfected between each use, or more frequently as needed, in order to protect against infection. See cleaning and disinfection instructions in the Instructions for Use. The V30 does not require preventative maintenance, but if you encounter a problem with your device, contact your biomedical engineering department. For additional information on the V30 Auto or any of Philips masks and circuits, please visit philips.com/healthcare or contact your local Philips representative.
Innovation in you. Philips.